Joining me now is Kristi Noem, the governor of South Dakota, one of the 13 states with trigger laws, and as of Friday, where abortion is no longer legal. Thanks for joining us this morning, Governor. You say this ruling is the answer to your prayers. Abortion is now illegal in your state unless the mother's life is in danger. There is no exception for rape, no exception for incest. What should the punishment be for women who receive abortions, or doctors and anyone who assists them?
Well, Martha, I don't believe there should be any punishment for women ever that are in a crisis situation or have an unplanned pregnancy. And South Dakota has been strong on that argument. What I would say is this was wonderful news in the defense of life. Every life is precious. South Dakota had a statute on the books that said that abortion would be illegal except to save the life of a mother should Roe v. Wade be overturned. And so that is how it stands here today. But I anticipate there'll be more debate and discussion. What was interesting about the Supreme Court decision is that it gave the authority back to the states to make these decisions. So now that this decision's been made, it'll be up to each of the states and the state legislators and the people there to talk to their elected representatives about what their laws look like closer to home.
The American Medical Association calls the Supreme Court decision a brazen violation of patients' rights, saying that states that end legal abortion will not end abortion. They will end safe abortion, risking devastating consequences, including patients' lives. You just heard Dr. Jen Ashton say the decision will affect women of color to an even greater degree.
Well, what's interesting to me, Martha, is that I've talked to many doctors who say when they do procedures on babies in the womb, when they work on babies that have not been born yet, that those babies are patients. So they define them as patients, and if they defend patients' rights, they should be defining and defending that life that's in the womb as well. And it is an individual, and every life has value. So in South Dakota,
but we're talking about the mothers as well.
That is
we're talking about the mothers as well.
Yes, we are, and that's what I'm getting to. Is this website that we have connects those mothers that are in this situation with all the resources that they may need during that pregnancy to support them financially, get them the health care that they would need, make sure they're connecting with pregnancy centers, and also making sure that they can connect with adoptive families should they choose to give that baby up for adoption. But we want to help support these mothers. I think we can do better in this country, making sure that we're walking alongside them in these situations and making sure that they do have the type of health care and the support financially that they need.
Well, let's look at that support. The Nonpartisan Commonwealth Fund, a social policy think tank, says the 14 states that have the most restrictive abortion laws, including South Dakota, invest the least in policies and programs for women and children. So what do you mean when you say these mothers will never be alone?
Well, I would say that the facts on the ground are that South Dakota is doing a lot to coordinate with nonprofits, with churches, and then also the state in a new way by launching this website and committing to in legislative session to support these mothers is incredibly powerful. You know, this is a conversation that we have a change now at the federal level. The states will be each evaluating how they approach this situation. Getting health care to mothers, helping them during a time of crisis is incredibly important. And these states, remember, Martha, are overwhelmed right now with other situations that are going on, with what Joe Biden is doing to the energy prices in this country, what inflation is doing in this country.
I want to stick with abortion. I want to go back to abortion, Governor.
There's a lot of things that need to be addressed in this country today.
You say every abortion always has two victims, the unborn child and the mother. What would you say to adult women in this country who do not feel they are in any way victims, that in fact they consider choices they make with their own bodies no one's business but theirs and their doctors?
You know, I'd encourage them to continue to follow the science, to continue to follow what we know to be true today with the technology that's been advanced, and to really look at the Supreme Court decision for what it is. Take the sensational pundit commentary out of it and look at the fact that what the Supreme Court did was fix a wrong decision that was made many years ago and now give the power back to the states. What they said is that the Constitution does not guarantee a right to an abortion. That means that each state will make the decision for themselves on what their laws look like, and that those women have an opportunity to speak to their elected officials there closer to home to make sure that their laws reflect what they value.
In 2006 and again in 2008, South Dakota voters voted down ballot initiatives for a complete ban on abortions. Would you be willing to let the voters of the state decide the issue again?
They decide the issue every single year when we come to legislative session. They vote for their representatives to come to session. We have passed many pro-life bills since I've been governor of the state of South Dakota. We've had heated debates and good discussions on the policy of what really is something that makes sure every life is precious in the state of South Dakota, that we're making sure that we are providing those types of resources and doing more even in the future to help those mothers and those families make sure that they're raising their babies or connecting them with families who would want to, should they choose adoption.
And what about medication abortions, the so-called abortion pill? How will you know if women receive those in the mail, and should those women be prosecuted?
I don't believe women should ever be prosecuted. I don't believe that mothers in this situation should ever be prosecuted. Now, doctors who knowingly violate the law, they should be prosecuted, definitely. And we've
But the pill is okay? You're saying the pill's okay?
Again, Martha, you're interrupting, but I am answering your question. I don't believe that telemedicine abortions are safe for individuals, for women to conduct at home. Many times they're doing it unsupervised. It's a medical procedure. And so I do believe that there should be a physician supervision in place when that is being conducted by any individual.
And just one more question. What if your constituents travel to another state to get an abortion?
You know, that certainly isn't addressed in our statute today, and so I think that's things that there'll be debate about, but also we're having lots of debates in South Dakota, how fundamentally our life has changed the last couple of years, just with increased costs and inflation, and what this administration is doing to every single family's budget and life right now going on in this country.
Thanks very much for joining us this morning, Governor.
Thank you, Martha. Have a wonderful day.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.